Hi, I'm Alicia Cates with Mid-America Regional Council, and I'm working with Climate Action KC to form a regional plan for climate resilience. And today I'm having a climate conversation with Daphne Bascom from St. Luke's Health System, and she's the Vice President of Population Health. And today we're going to talk about health and climate resilience. So thanks for joining me today, Daphne.
Thank you very much for inviting me to the conversation.
So how about you tell us a little bit about your work at St. Luke's Health System?
Thank you for asking. Most people don't know what population health is, so I will define population health, and it's based on a definition from Kindig and Stoddard back in 2003. Population health involves the development of strategies that link clinical and non-clinical approaches. So, for example, ensuring that we can have people have access to housing, that we address their needs related to food or transportation. It's really focused on improving the health of a group of individuals, including understanding what those outcomes are. So my goal is to partner with the community and community organizations to find a way to educate, empower, and engage people to stay healthy and to reduce their need to access our sick care system.
Great, I'm glad you shared more about that. I remember when I met you, I asked, what's population health? So thank you for making that clear for us all. So in what ways do you see climate change impacting health outcomes for our region? What things are you seeing in your work?
Well, first of all, I'll state that I'm not a climate scientist. I'm just a doctor. But so my thoughts reflect my understanding of the science and through the lens of a healthcare provider. I think that there's increasing recognition of the connection between climate and health. It's often viewed as a public health issue, and I'm putting that in quotes, and not what health professionals need to deal with on a daily basis. But we see the effects of climate change in our clinics, in our urgent care centers, in our emergency departments every day. So if you think about air quality, pollen levels, and heat stress, all of these can exacerbate conditions such as asthma, COPD, or chronic obstructive pulmonary disease, or emphysema, and heart disease. It would be great if we could write a prescription for patients to ensure they had air conditioning at home and that they had high quality air filters. Or it would be great if we could work with organizations like Bridging the Gap to increase tree cover in metro areas and reduce the urban heat islands. But this hasn't traditionally been the work of healthcare systems. Mm-hmm. I think what's concerning to me in part is that our community members who may be at greatest risk for chronic disease or poor health outcomes are already vulnerable socioeconomically and are most likely unable to cope with the consequences of climate change.
Great, that's it's good to see that intersection of health and just for people to think about things that we normally consider only health issues, how it's tied into the way the weather and the climate is changing. So tell us a little bit about your vision for what a more climate resilient Kansas City metro area would look like.
Can I dream for a few minutes?
Yes, that's the goal.
So the climate change will have serious impacts on the region in the years ahead. And climate resilience needs to be part of our urban and our healthcare policy. I also think it's a smart investment to build a healthy community because that will help attract new residents and new businesses to Kansas City. In light of the current dialogue across our community and across the U.S., I want to stress my personal belief that environmental issues and social justice issues are interconnected on multiple levels, and that this interconnection also impacts the health outcomes of our community. I don't think we can develop a comprehensive climate resilience strategy without also adjusting and addressing some of the social justice issues in our community. So climate change has worse effects on people who have low health equity, and those in our community who lack health equity are more likely to be negatively impacted by all of the factors we discussed earlier, which we call the social determinants of health. And they're the conditions where people live, work, learn, play, and preach. So again, not being an expert in this area, where I think there are opportunities, and in doing some of my own due diligence in this area, I think what comes to mind are examples of what's going on in other cities like Chicago and what Chicago is doing with urban farming. If we were able to develop some strategies related to urban farming, this could help protect the food supply. This could provide healthy food for the community. As we all know, poor nutrition is one of the leading causes of poor health across the United States. Funding programs that green the urban ecosystem and reduce urban heat islands may also reduce potentially avoidable utilization of healthcare. And so investing in safe, walkable communities will reduce carbon emissions, and it may also encourage our community members to be more physically active, and this can also have positive impact on health outcomes. From a healthcare system perspective, I think we can work to better reduce our carbon footprint. We can reduce meat served in our hospitals. We can reduce food waste. I mean, these are active steps that we can take today that we know will impact the health of our community and also impact the environment and the climate. I mean, these are just a few examples, and I could probably think of more or share more, but what I do want to close by saying is that no one organization or no one group can address the problem alone. We'll need to partner across the region. We'll need to partner with our public health departments, and this partnership is what will allow us to succeed in improving health equity while also building climate resilience into our community health improvement strategies.
Wow, that's a comprehensive, holistic, and actually I think it's a dream that we could plan for. So I appreciate you sharing your time with us today, and definitely good to know what population health is. And I hope that we can work together more on these issues soon. So thanks again for joining us today.
I very much appreciate this opportunity. Thank you.
And if any of this discussion has piqued your interest to get involved and learn more about climate change or participate in some of the activities we're having around the plan for climate resilience, I encourage you to go to the website to see what we're up to right now as far as getting people involved or who you can call and maybe participate on a committee for the Climate Action KC. And you can go to the website here, so the website that's shown there, to learn more about it. And I'm Alicia Cates from Mid-America Regional Council, signing off on our climate conversation.